What is up, fellow student nurses? My name is John and you're watching the Student Nurse channel. So for today's video, I want to go ahead and give you guys a list of items that I normally have with me that I recommend you also having with you everywhere and anywhere you go. Now keep it in mind, these are the items that are, what do you call it? Not generic, but the basic items that I recommend you guys having. So if you do guys go to the ED or to an ICU, high dependency unit, these are like the fundamental items that you should really be having anywhere, to be honest. Anywhere and everywhere you go, I recommend you guys having this. Now these are the stuff that I normally have on me, either on my person or on my bag anywhere I go. So if I ever need anything like the tape or anything, I can easily just grab it from me or the bag. So let's go ahead and get straight to the bag. Let me go ahead and grab the camera and let's have a look at the bag here, shall we? Alright, so this is the bag that I normally carry. Okay, so first thing you look, I'm not going to go into detail with my bag. Let's go ahead and open up what's inside. Keep it in mind, I do have a lot of orange stuff in here, so try not to judge too much. Okay, so item number one, or set of items number one, I recommend. Literally have a lot of, where are they? They're hiding somewhere here. Literally have a lot of pens. You are not gonna have too much pens. There's no such thing as having too much pens, because the amount of paperwork we do, the amount of documentation, the amount of, recording, written work, and noting down, it's just too much. You're bound to run out of ink on one or two, if not all of your pens, sooner or later. Also, there's always going to be people out there who's going to be like, hey, can I borrow a pen or two? So they grab it, and you think you're going to find them, but you never do. Okay, that pen is forever gone. So having multiple pens on you as well as in your bag is beneficial. I recommend about 2 or 3 on your person, just in case some colleagues do need pens. You can just get 1 or 2. I normally have somewhere, wait, it's not here. Let's have a look. Nope, it's not there. Like something like these type of pens as my primary one, which has multiple colors, but I recommend just using black for any legal or actual documentation, because black is what we need to document stuff. But something like this is my primary pen. It's perfect, and I normally have 1 or 2 of these type that I can easily just give to a friend or to a doctor or to a colleague so that they can use that. And normally these are like really cheap, so I'm not worried on whether I'm going to get it back or not. Okay, so that's item or items number one. It's a lot of pens, like a lot. Okay, item number 2, which I only have 1 here actually, is highlighters, or a highlighter. Again, I only have 1 because I don't really lose this as often compared to pens, and these actually last for a while. These are quite important and very, very beneficial, especially when you're looking at handover and you see a DNR, highlight that. You see someone on a specialized medication, whether that's Parkinson's or specific, we call it antibiotics that needs to be given at a specific time, you highlight that. As well as if anyone's diabetic, you can easily identify who's who by highlighting such stuff. Whatever color you guys prefer. It's just I got too much orange stuff here. So that's item number 2. Okay, item number 3, I recommend you guys having a notepad, like a small one. It doesn't have to be too big, just enough that you can actually document some stuff. So these are really, really, really handy, and I really do recommend you guys having it. Put it in your pocket, your back pocket, whatever. Whenever you're on the phone with either relatives or other healthcare professionals, if you need to write down something you guys need to remember, just put it in there. It's helped me multiple times, whether I'm looking for a specific type of drugs from a different ward, which I don't really know the name, I just write down and boom, we're good. Or whether transport's booked. Heck, even I do my own planning there. This little pad on what a patient has to do or what a patient has to go through, and yeah, so this is a big lifesaver, and I recommend you guys getting it. It's like £2 or £3 for 2 of these at like Tesco or Asda. So just look for a deal. It doesn't have to be a pucker one, just get a normal one. Just like it because of the paper are quite thick. So yeah, that's number 3. Number 4, nope, we're not going to that yet. Number 4 is a lot of Sharpies. Now they can be used pretty much as highlighters, but Sharpies are just a lot easier to use to mark stuff with, whether that's marking bandages, marking products for patients, like putting them in the fridge, like a specific type of food that their relatives brought in, and then you put the name on it. Just have Sharpies. Literally, you can do a lot of marking and what do you call it? Labeling with a Sharpie. Don't recommend labeling a whiteboard with Sharpies though. Just avoid doing that. Okay. Next item is a flashlight or a pen light. Okay. Now, newer obs, gotta make sure the pupils are dilating. Very useful, especially in a night shift. I've seen a lot of healthcare professionals carrying a headlight like this, like that, putting it around the head. It's not really recommended. Well, I personally do not recommend it, simply because that's probably going to scare a patient when you see like a red light or green, whatever light they use, walking down the hallway. As far as this, you know, if you're doing a night shift and you gotta go look at people's catheter bags, see how much is drained, it's not really that bright, you know. And again, like I said, you can check pupils for this, and it's good. Okay. Next item, yes, scissors. Now I have 2 on my bag normally, 1 on me and then 1 on my bag. Now these are trauma shears, and I got them for like £2 or £2, not bucks. £2, very inexpensive. You could also get the bandage scissors, which is the metallic looking one, but they normally cost a lot more than these ones. Like I said, these are like £2 instead of the metallic one, which is £10, I believe. Yeah, £10. You never know what you're gonna cut, or whether a colleague is gonna need scissors. Literally, always have them, and pretty much every shift I go on, I use it like multiple times, and so does my colleagues. So it's always safe to have scissors with you. Just gotta make sure that you either put it in a safe location on you, where no patient can easily grab it, especially if they've got dementia or quite aggressive. Just make sure they're really hard to get to, because if they're loose, someone's either gonna grab them or it's just gonna drop out. So have it really close to you. Either have it in your side pockets, in your trousers, or like in the I normally have a breast pocket right behind everything, so it's actually quite hard to get. So that's what I recommend as well. Trauma shears. I'm trying to get a Leatherman Raptor, but they're like £80. Alright, next item, a roll of tape. Now, again, pretty much like scissors, you never really know, you're never not gonna know how much you're gonna use this, but you will once you actually start working, or once you're in clinical. Pretty much every patient with a cannula is gonna ask you to tape up their cannulas, because it's just dangling everywhere. Roll of tape. Now, what with these, I don't recommend you guys hanging it out on like either a lanyard or your ID badge. Just put it in your pocket, because infection control is gonna chew your butt. Okay? Yeah. Like for this is designed for a stethoscope, but we don't normally do it simply because of infection control. So yeah, roll of tape, always gonna need it. You can do a lot of things with it. But yeah, so alright, what else do we have here? Hand sanitizer. Now, depending on where you are, you're probably going to have a lot of hand sanitizer dispensers on the wall, but it's always convenient to just have it on you, or anywhere you go. Really, it's just nice to have. I think the hospital provide these, so if your hospital doesn't, alright. I normally have a handful of stuff that you can get for like £2 from like Amazon or your local Tesco's, as this hand sanitizer. Normally bedside would have them, like next to the bedside. And that's pretty much what I basically have. Oh, of course, yes. We're not going to do the ID because that's just ID. A fob watch. Now, compared to the States, here in the UK, you got to be bare below the elbow. No watches, no bracelet, no nothing. The only thing you can have is like a wedding band, which yeah, I don't have. So we have a fob watch, which is normally attached to our tunic / scrubs. I normally put it by the left breast side of my chest. I mean, you can get a watch and you can just dangle it on your belt loop or something, but seriously, these are so much more convenient than those. Instead of having to reach all the way down and even stretch your neck, you can just literally look down at your chest and have a fob watch. So that's pretty much all my items in my bag, and normally in mine is this. I don't carry that. Mine is what was I gonna say? Oh, I completely forgot. But yeah, so like I said, this is all the stuff I normally have in my bag / on my person. Now let's go to the final one, which is one of these guys. So here in the UK, it's quite, what do you call this? It's not used as often as I'd like it to be used. If you go to a generic normal ward, you're probably just gonna see like the doctors having it and a couple of nurses. And those are normally specialized nurses, such as outreach, heart failure nurses, cardiac nurses. But other than that, it's quite rare to actually see a floor nurse having one of these. But since you're a student, I recommend you guys having it, simply because it allows you to actually learn how to use this from the very beginning of your training till the end, where you can actually use it once once you're qualified. Especially if you're interested in either outreach or cardiac or respiratory. Really good to have. Again, since you're a student, patients are a lot more, well, from my experience, patients are a lot more reluctant. I wouldn't say reluctant, a lot more open to actually allow you to listen to, whether their heart or their lungs. Just gotta make sure you tell them what's going on, and they give proper consent. So this, really recommend having this, simply because it's a great learning tool. And for me, fortunately, I've been able to actually get doctors who's been willing to teach me with these, and I think it's really just trying to make sure you guys have a good connection with the nursing staff and the doctors. So these are all the stuff that I normally have on me / in my bag anywhere and everywhere I go. So hopefully this is kind of like a guide or like a guideline that I recommend you guys following. Again, yours can vary. This is just what I normally have. Depending on where you are, whether you're in an acute set or not acute, a specialized unit, you're obviously going to need more stuff, but this is just what I have. Anyway, hopefully you guys enjoyed the video. If you did, leave a thumbs up, and hopefully I'll try and make some more videos in the future, because I think I'm like a day late to what I promised, which is daily videos once a week. Not daily videos, like one video a week. Anyway, you guys take care.